Good morning, everyone.
Good morning.
It's Friday. Thank goodness.
Good morning, everyone, and welcome to the meeting of the Integration Joint Board Clinical Care and Governance Committee. Those of us who are here in person are in the Grangemouth Community Education Centre, and this is going to be a new venue that we're using. We've only been here a couple of times, so if there are technical difficulties, I make my apologies in advance. There may be, we're just settling into the use of this building. We are live streaming this, so there may be people watching from outside, so welcome to them too. We have this morning, just starting with the agenda, we have apologies from Patricia Cassidy, Andrew Murray, Roger Ridley and Gail Woodcock. Do we have any other apologies?
No further apologies received, Chair.
Okay, thank you. Next, do we have any declarations of interest? No declarations of interest. Okay. So I should have said to start off with, I'm Councillor Anne Hannah, the chair of this group, for those who are not familiar with me. So can we just begin with the action log, please? Sorry, the minutes first. Minutes of the previous meeting. Has everyone had time to have a look at it? Can we agree it as a correct minute? I'll assume that's agreed then. Does anyone have any matters they want to raise on the minute from the last meeting? Any matters that are not covered in the agenda? No matters arising. Just in case I get this wrong, I am trying to check on hands on the screen as well as in the room. I will do my best to keep people in order, but I mean in the order in the order they put their hands up, as well as in order generally. Okay, moving on to the action log. Has everyone had time to have a look at that? There is only one item on the action log, and an update is included in the complaints report as an item on this agenda today. So I presume there are no other comments to be made on the action log. Okay, so we'll go on to the first main report, which is Living Well Falkirk update, and that will be presented by Lynette Denovan, who's on screen here. Did I pronounce that correctly?
Yes, absolutely. Thank you, Chair.
Thank you. So would you like to present your report, please?
Certainly, thank you, and thanks for the invitation to the meeting to present this report. Rather than read through the full report, which I'm sure committee have already had an opportunity to do, I thought it might be useful to come to certain parts of the report and just expand a little bit further on some of them. The first of that, and I think the really important part for myself, is the life curve, which I've shown it just below number 3.3 on the report. I think that's the part that's the kind of unique part of our of the system that we use in Falkirk, as well as the other local authorities that do use the same system. But for me, we should be focusing a great deal of our energies on moving towards a more able ageing population, and where individuals need less support from health and social care services, or if they do need support, they need that much later in their lives. And that's what I'm really keen about in terms of getting to see people earlier. Looking at that graph with the structure of the life curve on it, I've had a look at some studies. There was a national study done across Scotland, the Scottish Allied Health Professions Survey. There was data gathered in May 2017, and that was reported on in 2020. And that report identified that the average cost of healthcare supports for people having difficulty in the top 4 bands of that life curve, the cutting toenails down to the walking 400 yards. The average cost to healthcare to support people is £2,700 per person per annum, and that figure doesn't include for primary care costs, except for prescription costs or the cost to social care or to the individuals themselves. And going down as far as the later stages, obviously the committee will understand that as people need more support, these get more expensive, and that within the later stages, the average cost to support someone in the bottom 6 activities, or someone whose support needs sit in that range, is £12,300 a year. And the study then was able to identify that moving someone up just 1 stage on the life curve, on average, produced a saving of £640 per year per person. So the drive for all of us to live our best lives, as well as for our service users to live their best lives, and the potential to minimise health and social care costs, I think is really significant. Hence why I'm so keen on the life curve and keen on Living Well Falkirk. I've given some of the data where on usage of the Living Well Falkirk website, and at 4.6 specifically, I've mentioned about the usage over the past year of life curve assessments. That's assessments where people can look at how they're managing in their day-to-day life, and how well they're aging, or how well they're managing to keep able as they age. And the other type of assessments mentioned, there was 699 within other areas of the Living Well Falkirk website. So just to give a flavour of what these other areas are, where people are looking at specific difficulties within areas of their home. The top 5 assessment areas are the area of the bathroom, which I'm sure none of us who work with people in health and social care will be surprised about. Coming down that list, that took up 29% of people's usage of the website. Then the entrance area of their home, then stairs and steps, personal care and bedroom. That was our top areas. And narrowing that down a bit further, where people were looking at difficulties with their within the bathroom area, the most common things were finding it hard to step into the bath or stand in the bath to take a shower, difficulty with taking a bath, standing long enough in their wet room or standing long enough in a separate shower. So lots and lots around the bathroom. And people going directly to the equipment catalogue, people who had identified an area that they wanted to just help themselves. They didn't want to go into the detail of an assessment. They just wanted to find an item. The most common area that they were jumping to within the equipment catalogue was, unsurprisingly, the bathroom. Moving forward to the work that we've been doing in the Living Well Falkirk Centre since that opened. That's in and around number 4.8 in the report. I've showed the impact on where we're taking a snapshot of the waiting list of people waiting on this type of assessment, this simple ADL difficulties. At the time when we were looking to restart the Living Well Centre appointments, there was 141 people waiting for these assessments. And I've given you the breakdown of what we did as we screened these waiting assessments and the people who came forward to Living Well Falkirk, who were offered Living Well Falkirk Centre appointments. But just to, I suppose, bring that right up to date, within the first 5 months from the 24th of October up to date, the Living Well Centre, that's one part-time worker at the moment, has done 165 areas of need assessments with people. So that's where someone comes in saying, I'm having difficulty with the steps at the front door of my house. And some people might come in with 2 or more difficulties. So that 165 is not 165 people necessarily, it's 165 assessments. But just, I suppose, showing how we can really, if we are taken the Living Well Falkirk approach to people identifying difficulties with their activities, the daily living tasks, we can really speed through these and get to people much more quickly. And I think that's one person working part-time getting through 165 assessments in that time is a really good achievement, and that's 165 activities that we're able to support people to be more independent in than they would have been if they were waiting for more traditional services or had to wait for a home visit appointment. That's the parts that I thought would be useful to expand on for committee. But if there's anything else that committee wants to ask about the report, or if I can give more detail, then I'm happy to do that.
Thank you, Lynette. I think this is a really important report if we want to maximise the independence of our citizens in the Falkirk Council area and in the Forth Valley area. Then we need to maximise their ability to continue in their own homes. And I look forward to further reports on this as the process gets more bedded in. Now, earlier on, I did see a hand up, but it's gone down. Was that an error? Right. Okay. Does anyone have any other questions or comments they would like to make? I have Sarah Lacey with a hand up, I think.
Thank you, convener. Yes, my hand is up. Lynette, thank you. I've definitely benefited from this update, so thank you for the report and the presentation. Just a question, Lynette, in relation to 4.9 around ongoing developments, and you let us know that we've got 2 temporary social care officers being recruited. Importantly, part of their role will be about updating the system with kind of new signposting opportunities. I'm just wondering what thoughts we might have currently, or whether it's just something to build into future thinking around just how we make sure that that is a sustainable position, because it's those updates that are really critical, aren't they? Is there's new developments, either they need to come off or added. I just wonder if there was any thoughts about that, or whether it was just a comment to take away. Thanks.
Okay, Lynette.
Thank you. I have had thoughts about how that can be made sustainable to an extent. It's still going to require some staff and resource to do that. Sarah, thanks for the question. My intention is to follow a model that there is a Scottish database about groups and activities, but that's quite widespread, and obviously Falkirk is a much more localised system, and there maybe will be much smaller scale groups and activities that we want to report on that won't necessarily be in the Scotland wide. But I do want to follow their model, and what they do is annually they send out just a proforma template to all the organisations that are listed, saying, is there an update? If not, your entry will stay as it is. If there is an update, please can you give it? And we've got a deadline. Earlier in the last year, I made contact with both CVS and our own community education, and both have indicated that they would be able to help with getting letters out and these templates, so that, because we've got a much smaller number of entries on the website just now than I'd like there to be. So we need to get to a point where we grow that in the first instance. So I would be looking to our partners to help us get letters and templates out to organisations and clubs and groups and whatever in the area as a first off, and then thereafter it'll be a case of sustaining that. And we will also rely on our staff groups to let us know, to just give us a nod if they come across a new group or activity that we can make contact with and invite them to have an entry on the website. So thanks for that question. That's the plan behind it. Thank you.
We're going to pause the meeting because there's an issue with the live stream. So just bear with us, please. Okay, that appears to have been sorted. Does that answer all your queries, Sarah? Yes, okay.
It does, thank you.
Right, Thank you, Lynette. I have Elaine Kettings next.
Thank you, Chair. Lynette, thank you for sharing the report with us and the information about the Living Well. I really like the person-centred approach to the business and to kind of the community focus. But I was wondering about the near me element of it and the success around that. I've done a piece of work around kind of, you know, doing that near me with people in their own home. Well, a lot of kind of older adults, it's a bit trickier to do that. They don't have devices and they don't have the ability. And I just wondered if you had what kind of successes you've had around kind of trying to support people with devices in their own homes, because assessment in their own homes much better, I would imagine.
Okay, would you like to come back on that, Lynette, please?
Sure, thanks, Elaine. We've had some quite good successes so far with Near Me. And the good thing is the person that's been covering the centre until we have these new social care officer posts, the new recruits actually in post, is quite IT savvy. So she's been a good example and a way to move forward and use Near Me. At last count, she had done in the regions of 30 Near Me appointments using she's sitting in an office space using the Living Well Falkirk tool, but she's able to speak to people using the Near Me technology. And I guess it's just a mixed bag. For some people, they can get a family member to support them. For some people, they can use the technology themselves, but it just gives us one extra, I suppose, method of being able to contact people. So if they're not able to get out and about, but they do have that IT access to IT and that ability, that's an extra choice. If we can't get to them in either of those ways, then there is still the option for them to be referred to our locality teams and wait for a home visit assessment. And whilst we can deal with high numbers quickly of people who need these smaller ADL assessments, it does help then free up some of the team's time to be able to get to the people who can't get out and about. So we're doing a spread of ways of getting in contact with people. We will grow some more of that. We obviously have our technology enabled care development officer post in Suzanne's team, and I've certainly been linking with James Spence, who's in that post currently, and I've already set in motion that the two new staff, when they start on the 11th of April, part of their induction will be to link up with James and just see what we can do to keep growing together and you know, have our older citizens as digitally enabled as they can be.
That's great. It's certainly more efficient if we can work that way as well, isn't it?
Absolutely.
Thanks so much,
Absolutely.
Lynette. Thank you.
Cheers, thank you.
Thank you, Lynette. I have Martin Tom next and then Suzanne Thompson.
Thanks, Chair. Thanks, Lynette, for providing this report and the update. I suppose for me, it's really good to see kind of the impact that part-time worker has had in terms of the waiting list. And I guess for me, part of the real benefit of this is that really early intervention and actually taking people off what are quite lengthy waiting lists in the locality teams. So I guess picking up Sarah's point, for me, that additional resource was to expand the model, and then I guess we will then really look at the benefits of it. But for me, it's definitely the right way to go. It's part of that prevention offer that the partnership, I guess, is really keen to develop. And for me, I guess anything that actually takes people off waiting lists early, gets them access to services that will hopefully improve their outcomes, is just really good work. So I am really pleased to see the progress that worker has made in such a short period of time. So just wanted to say thanks, Lynette, and look forward to future updates. Thanks.
Do you want to come back on that, Lynette, or shall we just move on to Suzanne?
That's fine. No, thanks for that feedback, Martin. I will pass that on to the worker that's been covering the centre. Thank you.
I think we'll take all our thanks for the worker who's covering it. Suzanne Thompson next, please.
Thank you, Chair. And Lynette, as you noted, that obviously there's been a lot of close work with the Tech Development Officer in terms of the use of Near Me, and as you rightly pointed out, I guess it's an option that's available to people to use the technology should they want to, but obviously there's face-to-face options to come into the clinic, so it's good to hear. Probably just in terms of the digital inclusion piece, just to expand on that, our Tech Development Officer has been looking at a lot of options last year, particularly to access some funding that was available through the Scottish Government for devices, and we successfully accessed some funding to purchase those and distribute those. And we also work very closely with one of our local organisations, AbilityNet, in terms of that digital awareness, and we've done quite a lot of things like tech tea parties to raise awareness, or one-to-one support, so that where people can, it's an option for them, and not just in terms of accessing services, but perhaps accessing families and friends and supports in the communities. So we're doing a lot of work there, and as Lynette says, particularly keen to support the Near Me and Living Well activity through some of the digital work, and again working closely with our libraries around how we make that awareness available. So thank you, Lynette. It's been a good report in terms of sort of seeing particularly the life curve and that reminder to us all about benefits of earlier intervention. Thank you.
Okay, thank you, Suzanne. Do you have anything you want to say on that, Lynette? Or just
thank you. Thanks.
Just thank you. Can I ask, just in terms of when you get the new staff in post, are there plans for more promotional work to advertise more the service to encourage more people to use it?
Yes, definitely. That's a really big piece of work that we want to do. First off, I guess supporting the locality teams. We had started on that journey in 2019, before obviously the lockdowns of 2020. We were running the Living Well Centre for 11 months before the lockdowns, and what we started with was our locality teams. Then branching into our colleagues in health in the REACH teams, and our next port on the agenda was the local GP practices. We had a formal launch event and invited all of the local GP practices, and some of them were able to come along to that. And we sent out some postcards advertising Living Well. So our start off will be to follow that path again, and then to continue with some further advertising, just to get the more of a public awareness of the Living Well Falkirk services. So yeah, that's something that I'm keen to get doing, using that staff resource that we're going to have now.
Thank you very much, Lynette. I don't have any other hands up, I don't think. I'm not seeing anyone. So I think we were only asked to consider and comment on the report. I think everyone's had an opportunity to do so, and I would just say good luck, and we look forward to further reports. Early intervention is absolutely vital to give people the best. Two things: to give people the best life they can have, but the second is also to avoid early deterioration. So keep up the good work. Okay, we will move on to the next item on the agenda, which is the medication assisted treatment standards update. And that, I think we have Phil Heaton to give us the summary of this. Yes, you there?
Yeah,
yes,
hi,
good.
Chair, thank you very much. I'm trying to get my camera and mic to work at the moment. Just a little bit of a request. There's a bit of a bug going around my house at the moment. My son is upstairs in bed at the moment as well, so I'm looking after a sick child, so a little bit of compassion from colleagues would be appreciated. The medication assisted treatment standards is a big piece of work that spans across the Forth Valley area. It's been in the production line for quite a while. It was first announced by the Minister for Drugs, Drug Policy, a couple of years ago now, and the first intention was to get the 10 medication-assisted treatment standards embedded within treatment systems across the country by April 22. That obviously has lapsed, and we are now working to April 23. The report details a specific part of the reporting procedure on this. And this is why I really wanted to come along to this meeting to explain this, because it is quite complicated and a lot of work has gone into this. The summary of the standards that you will notice on the report is against the report that we will submit to government based on the Chief Officer signed off implementation plan from last year. So all ADP areas had to draft out an implementation plan on how they would achieve the 10 MAT standards to enable people to have quicker access to treatment for substance use. And these implementation plans were required to be signed off by the IJB chief officers, the NHS chief exec and the council chief exec. Now, the implementation plan by itself doesn't specify that all the standards will be fully implemented by the date of April 23. It specifies what the progress that we will make towards it. So currently on the implementation plan, and I've been speaking to the rest of the MAT team around this, we are confident that we will hit all the points that we have set out for ourselves and signed off and agreed to deliver for the MAT standards by the next reporting period, which will be April of this year. However, that does not mean that all the MAT standards will be fully implemented, and this is the same across the country, and it's a really important distinction. Now, there's a separate public health team called MIST, MAT Standards Implementation Support Team, and they are concerned with the full implementation plan. And they released a benchmarking report last year covering the country and benchmarked each ADP area against each other ADP area. And that, so I'm getting really confused here. My mind's elsewhere. I probably shouldn't have come along to this meeting in the end. The MIST reports that we will be submitting in April will be predominantly amber, not green, but the plan that we signed off to achieve will be green. So there's a bit of complexity there. Martin is fully aware of this as the ADP chair, as is Wendy from the Claxton Stirling ADP as well. There's been weekly meetings about MIST. We're confident we will achieve what we set out to achieve, but that doesn't mean full implementation of the MAT standards by April 23, and that's the bottom line on this.
Okay, thank you, Philip, and thank you very much for coming along to present this report. It's much appreciated. I think all of us have had problems with the illness in the background. I sometimes think perhaps just giving apologies is a better idea. So I see Martin has his hand up. Would you like to come on next, please?
It was just, I guess, put in really simple terms, I suppose, what Phil's really just set out there. I suppose we understand it because we've been caught up in the middle of it for some time. In short, I guess two different parts of the Scottish Government have asked two different things. So we set out our plans and our trajectory to implement MAT standards with one team, which was all agreed, and then MIST have come along and benchmarked us against the time frames. So I guess we have those two different measures, which is why we have one set that's green because it's our plan and what we agreed we would implement, and the other that's amber because it's slipped the time scales. So in short, we've got, I guess, two different reporting lines going through. I guess for me, the report does highlight a lot of the, I guess for me, really significant progress that we've made towards implementing the standards. Some of the time scales for me were, I suppose, really unreasonable at the start. I mean, there was an expectation that we have these standards implemented, as Phil's highlighted, a year ago, and that time frame was really, really tight, given that we were in the midst of the pandemic and there was a lot of significant change that we would need to make in terms of how we deliver services for people. And actually, one of the real significant challenges is actually identifying staff that can come in to actually deliver those models, because it does require a real increase in the staffing model to I guess change the model of delivery. So Falkirk, along with other partners across Forth Valley have made really significant progress in relation to this. So I'm really pleased to see the report here. I'm glad Phil could make it because I know he was struggling with his health yesterday, so thanks for coming along. But yeah, I would just really support, I guess, Phil and the rest of the MAT Standards team in terms of taking the work forward. I've absolutely no doubt that we will be able to implement all 10 of those actions. So thanks, Phil.
Thank you, Martin, and thank you for being much more clear and concise than I was. Thank you, Chair.
Okay, thank you, Phil. Anyone else got any questions or comments? In that case, I think we should say a big thank you to Phil. I mean, this is a stubborn and difficult problem that you're trying to tackle, and it's, you know, there won't be overnight successes. So we do appreciate the hard work that's going on, and we now give you total permission to go and look after yourself and your son, and I hope you're both well soon. Okay, thank you very much. So again, the proposal, the recommendation here was simply to consider and comment. So I think we've fulfilled that requirement. So good luck, Phil. Next item on the agenda is the overview of the local oversight arrangements. And I have here Suzanne to do this, and I believe Francis is also available to answer any questions that Suzanne is not able to pick up. So can I leave you to come in with a summary, please?
Thank you, Chair. The report, as you know, is a standing agenda item for committee, and it provides an overview of a range of groups that have oversight of services and functions that are relevant to the Health and Social Care Partnership. And the report intends to provide assurance to the committee of these arrangements. So at section 4, we've included an update on the Public Protection Chief Officer Group and their most recent meeting held in December last year. And this included reports around data and updates, service updates around adult and child protection work, as well as updates on recruitment and retention in relation to public protection. An update on the Health and Social Care Partnership Clinical Care Governance Management Group is also provided at section 5, and this is a relatively new group that's been established. The group has made good progress in a very short space of time and has considered a number of learning opportunities that have arisen from recent inspection activities, including the HIS inspection report of the NHS Forth Valley site and the Mental Welfare Commission report on the Bowness Community Hospital. And both those reports are actually cross-referenced in the inspection report as the next agenda item. Work is also planned with that group for a second event, and that's about identifying solutions and changes required to improve our patient outcomes and experiences, particularly at points of discharge from hospital. NHS Forth Valley clinical governance arrangements for the NHS Clinical Care Governance Committee and their Clinical Governance Working Group is set out at section 6, and the reports that have been considered by both those groups are set out at tables 1 and 2. Care home assurance work continues, and the report provides an update for the period October to December last year. And during this period, all Falkirk residents who were in a care home had a review of their outcomes completed. Work will continue to ensure timely 6-monthly and annual reviews take place. Adult protection updates included at section 8 and the work of its 3 subgroups. And in addition to the update, committee has heard about progress to implement the MAT standards. An update on the ADP is covered and provided in the report. And we've also included progress around suicide and drug-related death prevention work. So in conclusion, the board is asked to consider and comment on the report at 2.1. Thank you.
Thank you, Suzanne. I don't know, has anyone got any questions, or would Francis like to add anything to that?
No, nothing further
Okay.
to add, Chair, but happy to take any questions if Suzanne and I can cover between us.
Okay, well, thank you very much, as ever, clear and concise. I have a question from Stephen McAllister.
Thanks, Chair. It's probably for Martin and with his ADP head on, and it links to the match standards. And I know we're still implicating these, and you've explained that we're running a little bit behind. Obviously, the theory that we will be reducing our particular drugs-related deaths. See, below that, are we thinking about what's going to be our performance measures round about that? Is there any thought going into that yet? You know, once they're applicated, how successful they're being? Thank you.
Thanks, Stephen. There's a whole Forth Valley wide group looking at exactly, I guess, that issue and the implementation of MAT standards at the moment. So we have quite a large multidisciplinary team and a steering group established to look at, I guess, all those issues that are going to fall out the back of the MAT standards. I guess for me, it will also be something that we look at through each of the ADPs once we've implemented them. So we are looking to build in really regular reporting. Given the focus from Scottish Government as well, I've got absolutely no doubt that they will be setting key performance indicators. However, we haven't seen those yet, but I'm hoping that we get to contribute to what they're going to look like. But I guess in future, my expectation would be that MAT standards will be monitored through the ADPs, and then I'll no doubt be bringing performance reports back to this group through, I guess, Suzanne's performance monitoring reports. But given the level of focus that we have on the work of the ADP in general, I've got absolutely no doubt that I'll also be bringing reports around actually what difference that's making to people back to this group and a number of others. So I guess watch this space is the answer, but there will be significant data collection falling out from the standards. Thanks.
Okay, thanks. Okay.
Okay, happy with that, Stephen?
Yeah, thanks.
Anyone else have any questions or comments on this report? I don't see any hands, so if not, we have then considered and commented on the contents of the report. So thank you very much, Suzanne, and thank you, Francis, as well. So we'll move on to the next item on the agenda, which is, forget this, the inspection reports, and this is for you to pick up again, I think, Suzanne.
Thank you, Chair. The report provides an overview of inspection reports of our registered services, and these are the reports that have been published since the last update that we provided to committee. The Care Inspection published a report in February, and that followed an announced inspection of our Joint Dementia Initiative Housing Support Service. The inspection and the service itself was assessed against 2 quality indicators and received 2 excellent scores and 2 very good scores, with an overall being very good, and that's noted in the report at section 4.4. We've also included at section 4.5 some of the feedback from that inspection report and the findings of our inspectors, who noted that JDI was a sector leading and supported experiences for people which were of outstanding high quality. So I think it's important to recognise the good work that's been done by the service in that regard. At 4.6, we've provided an update on the NHS Forth Valley escalation, and that's set out in the report, as well as the findings of the HIS inspection report that was published on the 5th of December. And again, Francis may want to sort of provide any sort of comments around that or updates as necessary. We've also provided an update on the visits completed by the Mental Welfare Commission and their subsequent reports. And there was visits completed to Bellsdyke Hospital and Bowness Community Hospital. And following those visits, there were recommendations noted and action plans will be developed accordingly. All inspection improvement plans are monitored through the services themselves, and in conclusion, committee is asked to consider and comment on the report at 2.1. Thank you.
Thank you, Suzanne. Do you have anything you want to add at this point, Francis?
Yes, thanks very much, Chair. It was just to add, just in terms of the HIS inspection report, just in terms of this committee's responsibilities, we have taken the opportunity to look at the HIS inspection report around the safe delivery of care and articulate the learning from that across the whole system. So we are not just looking at that within Forth Valley Royal Hospital, we're looking at that across all of our health and social care partnerships, including community services as well as inpatient services, and through our women and children's services. So not just looking at the report in its context that it was seen, but actually trying to translate that into a context that we can share the learning across our organisations and make sure that we ensure that the areas of development are picked up irrespective of where they're seen across the organisation. So happy to take any questions, and we're delivering that through an oversight and working group infrastructure from a governance perspective, but happy to take any comments or questions. Thanks, Chair.
Thank you, Frances. I don't see any hands up. I'd like to just commend people commend particularly the staff in the Joint Dementia Initiative and the excellent work that's obviously gone on there to have come up with such a good inspection report. I think that's really important. And also it's important, the issue about the assurance board and the work that's happening with the Forth Valley Hospital, and we hope that that is going to repair the situation as quickly as possible to give people the confidence that they should have in our health services. Since I have no other hands showing, I think we can say we have considered and commented on the report. Agreed. Thank you very much. So we will go on to the next item on the agenda, which is the Health and Social Care Partnerships Complaints and Feedback from October to December 2022, a performance report. And that will be led by Gordon Mackenzie and Fiona Donaldson.
Thank you, Chair. Is Fiona with us? Yes, she is. Thank you. Yeah, so Chair, there's two reports up today in relation to complaints and feedback performance. The first of those is the Q3 report, which we'll talk to just now. The detail of the complaints or the main themes around complaints probably be better to talk about those in relation to the annual performance report, the following item on the agenda. So that's the way I'm proposing to kind of focus my comments on initially. I'll speak to the social work adult services part of it, and Fiona will speak to the NHS part of it. There's two different, well, there's three different complaints processes, one for social work adult services, one for NHS, and one for the partnership itself. So the good news is there aren't any complaints in the partnership part of it, so we won't have to spend any time on that. In terms of the social work adult services complaints performance, I think the first thing I would like to highlight is that the performance has yo-yoed over the last 2 to 3 years. If you look at table 3, the table at 4.3 and table 2 below it, it shows that performance back in 2020, around 56% of stage 1 complaints were dealt with within timescale. That improved quite significantly to 77%. 21-22, and in the current year that we're reporting on, it's back down to 57%. And a lot of that is to do with the amount of resource we're able to put into focusing on complaints. And Lynette, who spoke very eloquently around living well, also picks up, was involved in 2021 in a lot of the work to support managers, frontline managers, to report and deal with complaints in a timely manner. And that's largely why we saw the significant improvement that year. Lynette's gone back to other activities, including the living well, and is an adaptation that she deals with very well also. And unfortunately, the improvement has not been sustained. We saw this developing in Q2 of the year. We started work with frontline managers on how to address that and support them to deal with complaints in a timely manner. But as we found back in 2021, it's a long, slow process to improve the performance, and it can drop away quite quickly. And that's again what we're seeing in this year. So it's disappointing to come to you and be back where we were a couple of years ago, especially as we did manage to improve performance in the intervening period. But I think we know what the issue is. It's about supporting frontline managers in order to be able to respond to those complaints in a timely manner within social work and adult services anyway. In terms of stage 2 reports, those tend to be the more complicated ones that get dealt with by more senior managers. I'm less concerned, although the performance in the last quarter has dropped off from 100% to 50%. We're talking about 2 complaints and 1 not being dealt with. And the very nature of these complaints, they can be very complicated. It does take a lot of time to gather the information and get to the individuals involved in those complaints and hear the complaints and deal with them appropriately. And sometimes it's just not possible to do it within the 20-day period. I'm looking at the quarter by quarter performance over stage 2 complaints, and you can see it was 100% in table 1. It's been 100% for the previous 3 quarters. 1 complaint in the last quarter that we weren't able to deal with within the 20 days. So in terms of overall trend, I'm not as concerned about that. I think it's been pretty good in relation to what my expectations would be, but the stage 1 complaints is where the work needs to be done in the social work adult services side of things. Thank you. I'll pass over to Fiona.
Okay, thank you. Fiona, you have any comments now on the NHS side?
Certainly, and thanks very much for inviting me. Just to let you know who I am, I'm Fiona Donaldson and I'm the Interim Patient Relations Lead. I took over following Mandy moving to another post. So during the reporting period for April to December 2022, a total of 17 complaints were received by the Patient Relations team, and these related to the delegated functions for the Health and Social Care Partnership. The overall year-end performance for responding to complaints with the stage 1 and stage 2 processes is 82.4%. On analysis of the stage 1 complaints, there were 4 stage 1 complaints received during the period with a performance of 75%, and 13 stage 2 complaints were received with a performance of 76.9%, achieved and responded to complaints within 20 working days. We have identified some top themes for the period April to December 2022, and these are detailed in point 4.12 of the report. Over the period, there are 17 departments listed against delegated functions, but only 5 of those departments received complaints, and they are detailed in the report in 4.13. Overall, out of all of the complaints that we received, the vast majority of these have been not upheld. And I would also state that no complaints have been referred to the Scottish Public Services Ombudsman for investigation.
Okay,
is there anything else you would like to ask me at this time?
Thank you, Fiona. Does anyone? Thank you very much to both of you for your report. And complaints procedure is really important. I mean, in an ideal world, we'd hope for no complaints, but if we had no complaints, we would wonder if we were doing as much as we should be. No organisation is perfect, so it's inevitable that there will be complaints, and it's really important that we have a robust procedure for investigating and, more importantly, learning from them. So thank you for this report. I'm glad that the level of complaints is low. Not so glad about the areas where there has been deterioration in the performance. But as you said earlier, resources are inevitably related to how quickly you can deal with things, and we need to keep a close eye on that. I'm not seeing any hands raised, so are there no questions or comments on this? In that case, we have considered and commented on this report, and we'll move on to the report which I think you said you wanted to focus more on in any case. So this was the annual report for the Health and Social Care Partnership for 2021 to 2022.
Thank you, Chair. So take the same sort of approach as we did for the Q3 report, but this time, certainly for social work adult services, I would like to focus on the categories of complaint and what we are learning from them, as you just touched upon there. But just to preface the comments, this report is dealing with the year from April 2021 to March 2022. It's the first annual report that we've done since I've been here in the last 3 years, and I would intend that we would bring the next annual report probably towards the end of the summer of this calendar year. So we've done it once. We'll speed up on how we do it and produce an annual report in a more timely fashion for the year that we're just coming to the end of. So going into the detail of the report in terms of social work adult services, from 4.6 onwards, we're looking at the categories of complaints and what we're able to find out from that. One of the things that we found out early on, and one of the reasons that it's taken a long time to bring the report forward, is that the existing complaints process, handling process that we've got that covers the council as a whole, it's not well suited to the complexities of social work adult services. To be frank, it's set up for a wide range of services, including people not getting their bins collected, not getting the grass cut, all that sort of thing. So actually getting the complaints into categories that are meaningful takes quite a lot of work, and working through the complaints and trying to put them in the correct category. An example of that in 4.6 is where, staff conduct, and you immediately think, oh my goodness, what are our staff out there doing? 31 complaints about our staff. And yes, there are things about, where people are parking and are driving on their way to an appointment, a visit or whatever. But there are also things in there where people disagree with the assessment that's being done. And quite naturally, some people will disagree. They're not happy with the outcome of the assessment. But it's a very wide-ranging category to look at. So you do have to go into the detail of that. And that's also true of the other categories as well. There's an element of we need to be better about how we categorise the complaints to make them easier to interrogate. And that's actually happened in the course of the past year. There has been work done on the complaints handling process. So we will have different categories, and we'll be able to report on that a bit more transparently, I think, or more helpfully going forward. So the majority of complaints or the largest number of complaints have been around things to do with people not being happy with the outcome of the assessment. In some respects, it's also about services which are not directly provided by the partnership. So, for example, care at home, there's 12 complaints there. That includes complaints against both in-house providers and external providers. That informs us as where we need to go in terms of looking at the performance of the organisations that we're contracting with, as well as our in-house service, to see what we can learn and how we can improve in terms of the way that we deliver those services. The numbers in terms of the overall number of assessments that we do and the contacts that we have across Falkirk are, in terms of the complaints numbers, are, as you said earlier, relatively small. But there are important learning that we can gain from this, and we are working on a number of different initiatives to improve services where we can, providing better information, for example, to individuals and informal carers about the costs of care and the process and how you can access a care home placement, that sort of thing. So we are learning from those complaints, and we're learning how to handle those complaints better. I'll hand over to Fiona and perhaps take questions at the end, if that's okay. You, Chair. Thank you.
Okay, thank you, Gordon. Fiona, would you like to come on to the NHS sections?
Okay then, can I just ask, this is the first time that I've done this, so apologies for being so bold, but is there anything at all specifically that you wish to hear about?
I think that to start off with, it's just an overall summary of the situation, and then people can ask any more specific questions.
Certainly,
if they want to.
Thank you very much, Chair. Apologies for having to ask that.
Not at all. There's never a silly question, only a silly answer.
Thank you. So yeah, we are having quite a few challenges within you know, our complaints team for the NHS as a whole, but we are working and dealing with these, you know, certainly, and any complaints that we receive, you know, we are trying to deal with them and deal with them as quickly as possible, in partnership with obviously all of the areas that provide information to us. We do any complaints that we do uphold, we always have an action, and we're always trying to learn from these. Is there anything else that you would like to ask me? Apologies if I've not been as specific enough.
That's fine. I wonder if you maybe just could say a little more about the challenges in the complaints team as a whole.
Yes,
I think that
certainly,
needs a bit of explanation.
Certainly, of course. So over the last few months, we have had staffing changes that have impacted our capacity within the team, and that has been combined with an increase in the number of complaints that we are receiving as a whole over the NHS and the partnerships that we're dealing with. And you know, obviously we are trying our very, very best to deal with these, work smartly to ensure that our patients and their families who are raising complaints are getting a quality response and a timely response as well.
Okay, thank you. And I think there's an issue here across both areas in terms of the resources and the staffing issues, and I recognise that there are problems arising with that. You know, at 4.7 we've got the lack of availability of care at home packages as being identified as an issue in terms of some of the complaints. So the important thing is that we know that appropriate action is being taken to resolve those issues. As long as you can assure us that that is the case, we will hope to see improvements for the future. I have a hand up from Francis Dodd. Would you like to come in now? And then Stephen McAllister.
Thanks very much, Chair. It was just to support Fiona's comments. I suppose some of the challenges is a combination of not just the challenges from a staffing perspective, but also our ability to free up our busy clinical teams in order to respond to complaints. However, we're trying to look at complaints within the health system as an opportunity to learn, an opportunity to consider what the implications are, not just in the context that they're seen, but also in the context across the organisation. And just to provide a bit of reassurance, we've got Fiona acting up into this post at the moment in support of the vacancy that we've got, but we will go out to recruit to that post once we recruit to the head of person-centred care who leads that team. So it's a timing issue, Chair, and Fiona and her team are doing an amazing job in the interim, but it's just to make you aware that not only the pressures within the team, but pressures across the clinical teams are causing a bit of pressure in this space. But just to reiterate our perspective in terms of complaints, we see them as a gift to us in terms of our opportunity to learn something that we potentially didn't know So that's our perspective on them. So just to add to what Fiona was already saying, Chair, thank you.
Thank you, Frances, and I think that does deserve to be reinforced, that complaints are about learning to make the overall service better. Stephen?
Thanks, Chair. Notwithstanding all the pressures and also one of our major complaints about the lack of social care packages, which is a national issue, I probably want one for Gordon and the council system, which is a bit of a catch-all and looks like a bit cumbersome to draw the data out. So are we thinking about how we improve that system, particularly around about the social care aspect, to make that a bit easier, as Chair's just pointed out, to identify the learning for us, which is really vital as part of that whole system? Thank you.
Thank you, Stephen. And Gordon?
Thank you, Stephen. Yes, I touched upon it in my comments earlier. Lynette, if she was here, would be able to give a lot more detail, but there has been quite a bit of work done over the past 12 months. Just to remind you that we're looking at a reporting period of 21-22. In the last year, in 2022, we've been working with the team who run the council's complaints handling service, as it were, to try and make changes in the categories there to make it a bit easier for us to delve into that information, make sure it's recorded in the right place, and draw it out to be able to provide the information that I think that you're asking us to do. Have I understood that correctly, Stephen? Was that the part of the question?
Yeah, it's about how do you make a catch-all system within the council a bit more responsive to the areas that we're interested in at this committee.
Yeah, we have done what we can do, I would say, within the limits of the existing system. Technologically, it's now about freeing up staff time to go in and pull out the detail behind some of that information in order to be able to present that in a way to this meeting that we can learn more from it and you can see more about it. It just takes time, unfortunately, to be able to go in, look at a report and draw out what that actually means. That one that's been registered as a staff complaint, is it about the driving? Is it about the way that they spoke to somebody? Was it about their availability, or was it about the fact that unfortunately they just couldn't source a package of care? And so the complaint has come in about that member of staff because they weren't able to source a package of care, which we know we can't get because there's a shortage of package of care. So it's that kind of process that we have to go through manually, Stephen, which is intensively staff intensive and cumbersome. And the IT system that we have for the council as a whole at the moment doesn't support us to go far enough, to drill down far enough into that in a simple way. It requires that kind of people part of it, somebody who knows what they're talking about to go in and interrogate the information, unfortunately.
Does that answer the question adequately, Stephen?
Well, no, it does, but I think that, I suppose the concern is where resources are pushed all over, and you're having to get people's time spent digging into something. And I think there's probably a potential there that we miss quite a lot, and we miss the learning in that system that clearly wasn't built for us to interrogate from a social care perspective. So I suppose that a longer term is how do we make that a bit more responsive so that staff aren't having to dig as deeply as they're doing at the moment. So I think that's probably one for the future to have a look at.
Well, hopefully the next report will have covered some of that ground, and since we're getting that, I think you said in June,
maybe August.
Maybe August. Okay, it's still better than this one coming at this particular juncture. So we look forward to that. I think I saw David Heron with his hand up. Yes, David.
Yeah, hi. Thank you. Good morning, everyone. This report is about the number of complaints received, and the theme of the complaints I guess what I'm left wondering is, and Francis said, you know, we treat them as a gift and we like to get these complaints and we make changes based on them. Should we see what the changes were based on them in future reports? You know, a list of, you know, what has been the outcomes of these complaints in terms of, you know, have we, you know, briefed people on staff attitude and maybe talked about training courses for staff attitude? Have we looked at long waiting lists and what are we actioning to improve them? You know, I guess just knowing what the complaints are doesn't really reassure us that things are happening and things are changing. And so should we see in the next report maybe just a wee bit more detail on the actions that have come out of these complaints, because that would be much more reassuring, I think. Thank you.
Thank you, David. I think that's a really very important point for both the social care side and the NHS side, because it's all very well us saying that we're learning from these complaints, but it's the remedial action to improve the service that's important. So I see, Francis, you want to answer that as well.
Yeah, no, David, I think that's a really good point. Absolutely. So Fiona and I all work behind the scenes to for future reports coming to this committee and also to some of the health board committees to see what actions have been taken and try to understand some of the outcome impact of those. Thanks.
Thank you, Francis. And I presume we can expect the same from the social care side. Yeah, that's a really important point. Thank you, David. Are there any other questions, points to be raised? I don't see any hands raised. So that being the case, I think we can say we have adequately considered and commented on the report as per the recommendation. And we'll move on now to agenda item 11, which is the Healthcare Acquired Infection Performance Report. And I think Jonathan Horwood is going to speak to that.
Yes, thank you, Karen. Good morning, everyone. So this is the quarterly report for October to December. I'll just highlight some of the salient points in this report, but also give you where it's appropriate some updates of where we are now as well. I think that'd be quite useful for you. In terms of COVID, our numbers peaked quite significantly by the end of December. We had around about 65 patients in at one point, 65, 70 patients at one point, and together with that, we also saw the advent of influenza A reaching our communities and also within the hospital setting as well. So we did find this particularly challenging, especially over the Christmas period and also the New Year, where flu and COVID were both quite significant numbers within our inpatient setting. Fortunately, those numbers declined quite rapidly, certainly influenza A over the first part of January. So the flu season this year was quite brief, thankfully, but nevertheless is quite significant at the time. Just quickly giving you a quick update of where we are with the COVID as well at the moment. You know, COVID numbers have decreased. You know, we were peaking around about 65 patients again in this quarter so far, but our numbers are reduced now to about 43 inpatients today. We have seen a different Omicron variant being introduced into Forth Valley. We did notice quite a sharp increase in our outbreaks over February within the inpatient setting, and we did look into this, and the whole genomic sequencing suggests that there was a predominance of another variant which has got higher levels of transmissibility. So this kind of reflected in our peak in our outbreaks. We also saw a little flurry of activity as well within our care home settings as well, but thankfully both that seems to have plateaued, and now we're seeing a slow decline in our COVID numbers, both within the care homes and within the inpatient setting. In terms of the care homes, say now the infection control nurse who's working with the care assurance team providing support to care homes has now come back within my team, and we're in the process of amalgamating those processes and what our findings are into our own systems. It's further complicated, further complicated things by we're moving into our organization-wide systems called Pentana, where we can put all this data in, including care homes as well. So I think going forward, we'll be able to present more relevant data to care homes in terms of the infection prevention control activities within the care homes relating to your area. So I think that would be probably useful to include that in this report going forward. Moving on to our AOP targets, these now have been extended to March 2024. They were initially set at March 2022, and then they further extended because of the pandemic to March 23, and now again they've been further extended to March 2024. These targets are under review. I'll go into a little bit slight more detail later on in my report, but these are under review now. Nationally, they are recognising some of these targets are out with the gift of infection prevention control teams to reduce these types of infections. But again, I'll quickly talk about that when I reach the appropriate section. For our Staph aureus bacteremias, we had seen a slight increase this quarter, but predominantly from those acquired in the community. But there were no reported cases both in Falkirk or in Bowness hospitals. Our device-associated bacteremias remain consistent and numbers remain relatively low, certainly in the hospital infections. And again, none reported in Falkirk or Bowness hospitals. Our E. coli bacteremias, which is particularly challenging for us, and certainly with our AOP target, we're continually way above trajectory. We did see a slight decrease in the last quarter, but again, numbers remain very challenging. And this is the area where particularly this target is under review nationally, because a lot of infections are being developing within the community, you know, those with urinary tract infections or infections associated with gallstones and along those lines. So this is why it's under review, because, you know, to prevent an infection being acquired within the community is a difficult, is quite challenging. Our Clostridioides difficile infections, we have seen an increase in our healthcare sourced infections. So these are those that are developed within the community rather than the hospital. It's not through outbreaks, I have to hasten to add. This is through antimicrobial therapy. So quite a significant proportion of the population has Clostridioides difficile within their gut, and when people are on antibiotics and so on, this can allow the proliferation and the organism that can cause symptoms of diarrhea and things like that. That's where sometimes you get diarrhea associated, antibiotic associated diarrhea. So it's that kind of infection that we've been identifying more frequently as being out in the community. So we're doing a bit of work around that as well. Numbers fortunately have dropped this year. Certainly this month we've seen, and last month we've seen a decrease, but we do understand from our data that C. difficile infections are seasonal. We do see an increase continually in the colder months, you know, certainly just after autumn time. We've seen that historically, and this is reflected nationally as well. So, but we are doing a bit of work there in trying to see, you know, what type of antibiotics are being prescribed in the community, and for what purpose, just to give us some better epidemiological data in that. Moving on to estates and cleaning compliances, numbers remain relatively consistent. Falkirk Community Hospital cleaning scores remain good. Falkirk Community the estate scores still sit in amber and sit at 88%, so it's remaining relatively consistent and just shy of the just over the 90%, which will put it into the green thing. There is a group that looks at all these numbers and looks at these figures and see how we can increase this percentage score back into the green. So work is still ongoing there, but with Bowness, all is well in terms of the estate and cleaning compliances, when we got 95% and 93% respectively. And finally, I just thought it's not mentioned in this report, and apologies for that, I should have put that in, is saying there's works undergoing at the moment in preparing the mental health wards across Forth Valley for future HEI inspections. You'll be aware of, we've had recent inspections within Forth Valley Royal, but they're extending their inspection remit into the mental health wards. So, in terms of Ward 2 in Bowness and in Unit 5 in Falkirk as well. So just to give you the committee assurances that work is ongoing there in preparation for any visits or, future inspections that we're likely to receive. It's going to be more IPC focused, how the inspection processes within the acute hospitals have kind of evolved now. They're looking at far greater remit compared to what they used to, is just concentrating on infection prevention control. They are starting back to first principles with the mental health units, recognizing that they haven't looked at these areas in the past, so they're looking at just solely from an IPC point of view. So, like I said, just to give you the committee assurances that work is ongoing there and to prepare for any future visits and to prepare, so all the staff are prepared for any intended visit that's due to come in the future. But happy to take any questions.
Okay, thank you very much, and thank you for this report. Just like maybe to ask a brief question. There is a kind of perception about the whole situation in relation to COVID that part of the reduction in numbers is related to a reduction in testing. I wonder if you'd like to just kind of say something about whether there is any kind of possibility that making fewer tests is resulting in the reduction rather than fewer incidences.
I would. Prior to in September, we tested all patients who were symptomatic and asymptomatic using PCR, so polymerase chain reaction, which is a very sensitive method of detecting any bit of the viral RNA within the throat. Now that picked up, it's very sensitive and it's a very good test. Unfortunately, it picks up old virus particles as well. So if you've had a positive within 90 days of infection, you're perfectly well and you have a swab, that swab will become positive on PCR. So there was a push nationally, and that questioned us as well then about the significance of some of the positive results. We used to test all asymptomatic admissions in the hospitals using PCR, and that used to identify quite a large number of positives who were completely asymptomatic with no symptoms at all. So there was a push nationally to look at the relevance of that. LFT testing is good for active infections. So when people do have an active infection, they invariably are LFT positive. So it was a more using a less sensitive test, but to give a more accurate result of current infection. So we did see a drop in infections, and we did monitor this very closely when we did move over according to national guidance. We monitored this quite closely because it's still unknown whether or not these positive asymptomatic individuals were carrying active viruses and whether or not they could spread. So we were keeping an eye on closely about any spike in outbreaks or infections within the inpatient settings, and we didn't see any, thankfully. So yes, currently now it is LFT testing, which is considered the better test for active infection. We always confirm, if we do have a positive LFT, we always confirm by PCR as well, but that's part of national guidance. But yes, we have seen it, but we think that's the more pragmatic approach, and I don't believe that we've seen any issues with a negative LFT then subsequently become positive by PCR and causing any outbreaks at all. Chair, thank you.
Okay, thank you very much. Just one other question on the cleaning regimes, and particularly the Falkirk Community Hospital, where on the estates cleaning you've got 80 odd %, which is the lowest figure there. I wonder if you'd like to make a comment on that, please.
Yes, what it is. So this is these are nationally set audits that the domestic teams assess on a monthly basis, and it's directed nationally as well. So if they see any damage to cracks in bathroom tiles or anything like that. The reason what we report on that is because they can't be cleaned properly. So a chip in skirting board where there's wood exposed or anything like that, that would reduce, you know, the percentage scoring for that particular area. So we've been looking at this for many years now, and you know we've looked at some of these things, and these are quite minor, dare I said, issues, but there's a lot of the minor issues. You know, if you're talking, if there's a bit of staining on bathroom sealant, say for instance, you know, that would be marked down, you know, and that would need to be replaced. So like I said, all the details of these minor issues that are identified are flagged up at our group that we meet with our states team and domestic teams, and then they look at these and see if they can actually assess and repair these things. We looked at this from a national point of view as well, and you know, comments have been received from other health boards that they've had very old Victorian hospitals with a 95% estates compliance rates, you know, and they're saying, you know, this is not such a I think what I'm trying to say is what we're reporting is a very accurate and very honest approach, you know, and we see from other colleagues, my colleagues across Scotland have said, you know, there's no way sometimes their hospitals would reach, you know, in the high 90s for estates compliance. So I think there's a bit of assurance in some ways that these numbers are a true reflection of what we're actually seeing. The issues that are